So my name's Allison Velden, and I'm the CEO for the Community Health Center of Franklin County. I've worked at this organization for 10 years, and I've been in the CEO position for just about 5 years. My background is as a dentist, and so before being the CEO, I was a dental director and a practicing dentist here. I had studied microbiology. I went in thinking language and religion, and at Hampshire College it can sort of morph. And so when I finished college, I had to figure out what to do next. And I literally sat down and I said, what's important to me? And I decided, a job where I work with my hands, where I have a skill that's really helpful for people, and where I can make an impact. And I landed on dental school to become a dentist. So once I finished dental school, I came right back to Western Mass, and I began working in local practices and in community health centers. And the more I worked in community health, the more I realized that it's a different model and that I really like the way that we function. Our community health center model, it provides so much more than just a single type of care for patients. It provides medical and dental and behavioral health and now pharmacy care and wraparound services, health insurance assistance and language, and really making healthcare more accessible. And so the longer I worked, the more I realized that this is different. This is what I like to do. And so I sort of just learned more and more about community health centers, about the community in general, and the health of the community, and how everything is connected. And so I pursued some more education around it. And then when the CEO of the health center retired, I applied for his job, and they gave it to me. So that's how I got here. I'll give you a little bit of the history of the community health center movement, because we're actually part of a much bigger movement in the country. During the height of the civil rights movement in the mid-20th century, there was an experiment done where there were large grants to support an experimental health center, one in a rural setting in Mound Bayou, Mississippi, and one in an urban setting in Columbia Point, Massachusetts. So Massachusetts is actually the birthplace of the community health center movement. And the goal was to not just provide medicine and nurses and doctors, but to provide an entire model where the needs of the community were determined by the community itself. And so they were able to do other things with this funding to try to impact the health of the entire community. And they did some really innovative things, like digging privies for sanitation, and providing food and also nutrition instruction. And from this movement, or from the seeds of this movement, we really leaned into, discovered the importance of social determinants of health, which can also be called health-related social needs. But basically, if you can't access healthcare, if you don't understand the healthcare, if you don't have your basic needs met, your healthcare won't be, the priority. You're not going to get healthier. And so our mission as part of that movement is to make healthcare as accessible as possible to as anybody who needs it, so that our entire community can be healthier and safer. My current job, I don't get to work directly with patients anymore the way I did when I was a dentist, and I miss that. But what I really enjoy and appreciate is seeing, from this whole organization perspective, the impact that we have on so many people in our own community. I live in Greenfield. I've been in Western Mass pretty much my whole life, and so it feels really good to know that the work that I'm doing every day is helping to keep this place that I love safe and healthy, to help people thrive in a way that I don't think we all could without access to care. I think that what I see most prevalent, that I think to me personally just rings the most true and is the most relatable, is the very high amount of medical trauma and just lack of respect that patients experience when they're navigating the healthcare system. Because everybody will need healthcare, even if you haven't needed it much, so far, maybe just for prevention, but eventually everybody has something that requires, some assistance in healthcare, and it can be really scary to be a patient, and then you add on just the layers of complexity that exist in our healthcare system, and it's completely overwhelming and very dehumanizing, and I think a lot of people can relate to that. So even if you are, a highly privileged person like myself, right, with some financial resources, education, high health IQ, we'll call it, navigating the health system can be just so frustrating and terrible. And for me, that's always the primary focus of everything we do, is to try to be patient-centered and to put the patient back in the center of their health care experience. I think that the vision is that everybody in Franklin County and the North Quabbin area, which is our service area for Community Health Center Franklin County, whoever they are, whatever their circumstances, health conditions, background, needs, whatever it is, that they have access to high quality, patient-centered healthcare. I think that's the core of the vision. And then beyond that, there's layers beyond that about if we were able to achieve that, we would also be bringing down the total cost of healthcare, and we would be extending patient lives and improving quality of life. And I mean, there's a ripple effect when a community is healthy. It would improve the local economy, all of those things. But really the bottom line vision is that everybody in our service area has access to high quality, patient-centered healthcare. So sometimes we say community health centers are the best kept secret in healthcare, and that's not a good thing. I see, in my perspective, community health centers and the health center movement, we're like the least broken part of an extremely broken healthcare system in this country. And I think when people view us as not for them or not for everybody, that I think is the biggest misconception. You can be homeless with no insurance and come here. You can have multiple chronic diseases and come here. You can be very wealthy, pay for your care out of pocket and come here. You can have, normal, pretty good employer-based health insurance and come here. We're really for everybody, and the quality of care and the goal of patient-centered care is not limited to any one group of people. So I think that's the biggest misconception, is that we're not for everybody, and we are 100% for every person who's in our community. We are looking at difficult times for the health center, really for the whole community, and particularly for certain subsets of people, groups in our community. And there's several different particular groups of folks that I'm worried about, both worried about being able to maintain their access to healthcare, worried about their safety, worried just about their livelihoods, and you know, the trauma that they may go through during this time. And one thing that I think is important to know, especially in Franklin County, in the North Quabbin area where we serve here, is that there are an enormous number of people, organizations, and individuals who are working really hard to stay on top of all of the changes and figure out how to navigate changes for everybody. So I think the thing that brings me hope is knowing that we are not in it alone, that we have amazing partners. And I think we can easily take for granted in this region how well we work together with each other. I know my colleagues at other nonprofits. I know town officials personally. So when something happens or when something changes, and I know small business owners locally, we can get together and we can try to solve problems for folks. So I do have a lot of hope that we will get through it. You know, no matter how hard it gets. But that is not to say that it won't be really challenging, or that there won't be things that happen that are you know, devastating for individuals and individual families. But as a community, we are very strong. So the Community Health Center of Franklin County is a 501c3 nonprofit health care organization. We have a board of directors that is required by statute to be at least 51% patients of the health center. And so there's a lot of different ways to get involved. I think I'm going to list three. I think this will be three. One, make sure the people in your life know about us, because we are your community health center for everybody. Doesn't matter who you are. If you're part of our community, this is your center. And so we are here for you. So I think knowing that and then sharing that information, there isn't anybody who isn't eligible to be a health center patient. I think another way would be for people who are interested in volunteering. We do periodically have board openings. We really need to have a diverse set of perspectives of people who care about the community. And it's not a small amount of work to serve on the board, and it's volunteer work, but that's an area where people can really help if they have time that they want to donate. And then the third thing is financial donations. We are expecting financial stress over the next few years, and we are a nonprofit, and so any dollar we earn from billing for services, anything we get from donations or grants, it all gets reinvested back into the community to provide services. And so I do think community health centers are one of the best local places to make donations.